Okay, now let us imagine a 22-year-old medical student who comes to the clinic, okay, and complains that she's having chronic diarrhea, fatigue, and weight loss. Now, one of the surprising part in the history is every time the student eats no the bread or pasta, the symptoms are worsening. So now the question is, why does something as common as what we eat regularly take, that is bread, cause these symptoms, right? Or indirectly, it is the wheat products which are causing the damage to the intestine. Okay, so more importantly, now the question is, what is this disease and what is the mechanism behind this disease? So in today's video, we'll understand the physiology behind celiac disease, how this wheat product, that is gluten, triggers intestinal damage. I think you would have heard, I think many people are allergic to wheat and wheat products, and that is what is called as celiac disease. Okay. The first we'll take a, like when the person takes, we'll just see step by step what happens. Let's start with the first step. That is when we take a food which contains wheat, it contains a protein called as gluten. Okay, the protein which is present in wheat is gluten. And the most important component of gluten, which is responsible for this disease, is gliadin. Gliadin is a peptide, a small part of this protein that is called gliadin. Normally, the proteins, whatever we take, no, in a normal healthy person, these proteins are completely digested into amino acids. But gliadin is resistant to digestion, so some peptides remain partially undigested. Now, these undigested gliadin proteins, so as you can see here, there is incomplete digestion of gliadin peptides. This gliadin gets absorbed in the small intestine. It gets absorbed in the small intestine. Mainly in the duodenum and jejunum, it gets absorbed. So, normally the intestinal barrier prevents large molecules from crossing into the blood. But in a genetically susceptible individual, what happens is this gliadin crosses the intestinal epithelium. That is why few people it is causing these symptoms. Okay, because genetically they are predisposed for the transfer or crossing of gliadin into the circulation or the intestinal epithelial cells. Once the gliadin enters into the intestinal tissue, an important enzyme comes into play, that is called TTG. TTG stands for tissue transglutaminase enzyme. This will cause a change in the gliadin molecule, that is called deamidated gliadin peptides are formed here. There is a slight modification of this gliadin molecule which is happening here. The process is called deamidation. Now, this modified gliadin protein, which was till now what has happened is it has become more immunogenic. This deamidated gliadin peptides now start stimulating your immune system. So this modified gliadin peptides are now presented to the immune system, and the antigen presenting cells will display the peptides with a specific genetic molecules called HLA-DQ2 or HLA-DQ8, especially in the on the antigen presenting cells. And these molecules are present in almost all the patients with celiac disease. Okay, remember HLA-DQ2 and HLA-DQ8, these are the proteins which are present on the antigen presenting cells, and this deamidated gliadin peptides are presented along with these molecules on the antigen presenting cells. That leads to activation of CD4 helper T cells. These helper T cells release inflammatory cytokines, and these cytokines now will start damaging the intestinal mucosa. So there is a immune attack on intestinal mucosa. So all the villi will undergo atrophy, and the crypts, no, the depressions, all of them, all the cells in the crypt and all will undergo hyperplasia. Because of these two changes, what happens is there's a lot of malabsorption, and that is what leads to symptoms of celiac disease, that is diarrhea, weight loss, anemia. Remember, these patients will have features of iron deficiency anemia also. That is why it causes the tiredness and all, because of the malabsorption. So how do I remember is, like, there is a small hint or exam tip what we can remember, or in small simple mnemonic is, remember this phrase: gluten irritates the villi. Simple thing. Okay, whenever you remember celiac disease, remember the gluten which is there in the wheat irritates the villi. So here gluten stands for gluten itself. I stands for, the irritation is nothing but, I is nothing but immunogenic. The gluten or the gliadin, whatever is present in gluten, becomes immunogenic, and because of the presence of T, because the enzyme TTG, remember tissue transglutaminase enzyme, will make this gluten product immunogenic, and that destroys the villi. So there is a villi atrophy, and that leads to malabsorption and other symptoms. Clear? So now you know the clinical physiology behind celiac disease. So how gluten triggers an immune reaction that damages the intestinal villi and leads to malabsorption. If you enjoy learning mechanism behind diseases and physiology of what we encounter in clinical practice, make sure to subscribe to the channel. I regularly post videos that simplify some complex medical concepts for health professional students. And if you found this video helpful, please do share it to your friends and classmates. It might help someone understand this topic better. And thank you for watching.